Hello and welcome to EUFOREA TV Breaking News. My name is Dr. David Bull. I'm a medical journalist and welcome to our first show of September 2021. Now, this show is all about the implementation of biologicals as a novel therapeutic approach in Japanese CRSwNP patients. In a minute, I'll be talking to Professor Shigeharu Fujieda, Professor at the Department for Otorhinolaryngology, Head and Neck Surgery, and Dean of the Faculty of Medical Science at the University of Fukui in Japan. After that, we'll head to Tokyo to speak to Professor Ruby Pawanka, who is President of the Asia-Pacific Association of Allergy, Asthma and Clinical Immunology and Head of the Allergy Division in the Department of Pediatrics at Nippon Medical School. Now, in Europe and the United States, chronic rhinosinusitis is divided into two subgroups: chronic rhinosinusitis with nasal polyps and chronic rhinosinusitis without nasal polyps. The majority of CRSwNP cases have a strong tendency to recur after surgery and show eosinophil-dominant inflammation. But this definition has proved very difficult to apply in Japan and East Asia because more than half of the CRSwNP cases do not exhibit eosinophil-dominant inflammation. So in Japan, the term eosinophilic chronic rhinosinusitis was introduced to differentiate it from non-ECRS. Now, CRSwNP is often difficult to treat, but the advent of new treatments involving monoclonal antibodies, or biologics, looks like very good news for sufferers worldwide and now also in Japan. Well, to explain all this and to tell us more, I'm delighted to be joined by Professor Shigeharu Fujieda, who is Professor in the Department of Otorhinolaryngology, Head and Neck Surgery at the University of Fukui in Japan. Very good to see you, Professor. Thank you for joining me.
Thank you, David. I'm very honored to be here.
Well, I'm very happy you're there as well. So perhaps I could start by asking you, could you tell us about the recent indication of using Dupilumab, which is obviously a biological, in CRSwNP in Japan?
Biologics are very nice medicine for chronic rhinosinusitis with nasal polyps. Especially Dupilumab is very effective for Japanese CRS with large nasal polyps. I was very surprised to see the disappearance of the large nasal polyps with the administration of Dupilumab. Last year, Japanese health insurance decided to cover Dupilumab for CRS with NP, such as refractory asthma and refractory atopic dermatitis. As for our CRS with NP, the Japanese Ministry of Health, Labor and Welfare has issued a guideline for its proper use, and there are quite strict restrictions.
Perhaps you could then tell us a little more about the refractory eosinophilic rhinosinusitis score. That's the JESREC score. Could you tell us what that score is all about and how it helps patients and physicians?
We conducted a Japanese epidemiological survey of refractory eosinophilic chronic rhinosinus study. We call it JESREC study. The aim of JESREC study are to understand the characteristics of ECRS, to establish clinical diagnosis criteria, and to classify ECRS. We developed an algorithm to classify the severity of ECRS. The algorithms consist of eosinophil percentage in peripheral blood, CT findings, and comorbidity. The algorithms was divided into 4 groups based on the presence of eosinophil in more than 5% of peripheral blood, predominant shadowing of the ethmoid sinus on CT, and presence of bronchial asthma or NSAID-exaggerated respiratory disease.
So tell me, Professor, how will this JESREC scoring system help patients better in terms of patient selection for biologicals?
Before performing endoscopic sinus surgery on patients with CRS with NP, the doctors can predict the likelihood of post-operative recurrence and explain the amount and duration of oral steroids to be prescribed after surgery by JESREC scoring system.
Well, thank you very much indeed, Professor Shigeharu Fujieda.
Thank you, David.